All right, yes, we are there. Oh, thanks for your patience. This took us about 10 minutes. Technology, it's not always easy, but we're there, we're with you, and we thank you for tuning in today with the Experium. I'm Menno Pistorius, Dean of one of the academies here of the HAM, and I'm here with me with Maurice Magnee, and we're going to introduce you in the Experium here in the HAM. Now, I will do a very short introduction, also due to the time lag that we have, and then Maurice will take over with his presentation. Probably we will not make it in 9:35, but if you can, please allow us to go a little longer, up to 10 o'clock. Now, welcome at the HAM, University of Applied Sciences. We are the University of Applied Sciences in Nijmegen and in Arnhem. And to shortly introduce you, and we have with 50 or even a little bit more than 50 people that are in this meeting at this moment, and also in any way one from Germany, Sarah Hussein from Münster, very welcome. So we do this in English also because of you. The HAM, to introduce, we have 37,000 students, which is a pretty large number, I can tell you. And we have about 4,000 employees. In the very important domain in this HAM are the healthcare and the social work studies. And altogether, we offer education for more than 10,000 students. And to focus in a little, we have more than 6,000 students enrolled in our healthcare program, which is nursing, which are the allied health studies, which has many more studies. And one of the major issues that we encounter in education healthcare students is, of course, technology in care. And technology in care education and technology in care in research. And in order to stimulate that issue in education, we set up a center, which is the Experium Health, and we are so proud that we have that center, and Maurice Magnee will introduce that to you. We have today and tomorrow a couple of, in our opinion, wonderful meetings for you, and you can see that in the overview in the meeting schedule from the Health Valley event. So I would say not hesitate any longer, and I would like to introduce you to Maurice Magnee as the director of this wonderful experience. Maurice, we have a couple of things here in between us. Can you shortly explain what do we see here and what do we see in the back of us?
Yeah, thank you. Good morning to all of you. Thank you, Menno. My name is Maurice Magnee, as Menno already introduced. We have a lot of different types of technologies here at our Experium Health Lab because we believe that experiential learning or learning by doing is very important, especially when working with technology. So that's why we have a large amount of different types of technologies here, and students, but also professionals, researchers can really hands-on experiment with these kinds of technologies to really try to also implement it into healthcare practice. So that's what we're trying to do here.
And a little bit more detail, what do we see here?
What we see here, this is the cradle. It's a wooden, in Dutch I always call it a wooden egg, but it's if you touch it with two or more people and make a circle of people together, the cradle will produce sound. And based on the type of connection you make with other people, different types of sound will come out of the cradle. So really alternative type of communication.
Yeah, and talking about communication, before you start with your presentation, Justine van den Berg is in the back office to answer your questions and to introduce questions that you may have for Maurice or for me. So please, if you like, do so. Maurice.
I will now switch to the presentation. I hope it's all visible also for the attendance. The Experium Health is founded based on the idea that there is already a large amount of technology available in healthcare and well-being. I will present this slide. But insufficient attention is given to the accessibility of these technologies. Also, insufficient attention is given to digital skills of professionals in healthcare. And insufficient applied research is done to really implement and validate these technologies. So that was actually the starting point of the Experium Health to tackle these issues. Our mission is to promote human functioning, resilience, and self-management with the help of technology. That's a big mission, but in order to achieve this, we want to strengthen collaborative capacity by means of interdisciplinary education. We boost professional competence by providing a platform for knowledge development, and also increase the learning capacity of students and professionals by, as I said before, hands-on experimenting with these innovations. Our activities can actually be summarized in 5 coherent packages of different activities. These are based on inspirational activities, experimentation, professionalization, implementation, and validation. So these are the 5 coherent packages of activities we do at our Experium Health Lab, always in collaboration with healthcare practices and students, of course. Can you see the next slide? Yeah. I will provide some examples of these different kinds of activities. And first, our inspirational activities. For instance, our students, which are associated with the Experium Health Lab, can organize inspiration sessions at different healthcare organizations or community centers, and take with them a lot of technologies, as shown here as well, and try to inspire professionals in these organizations based on their own preferences. So they can go to homes for elderly care or youth workers, and they take with them different types of technologies. So this is an example of inspiration. As soon as COVID will permit again, hopefully very soon, we will also organize these inspiration sessions again at your organizations or within our Experium Health Lab. Another inspirational activity is our yearly conference, Technology Talks. This year's event will be hopefully online around May this year. We're not sure about the date yet, but this year will be about virtual reality. And Dr. Brandon Spiegel, a world-famous virtual reality expert, will present about how virtual therapeutics will revolutionize medicine. We have a nice program full of keynote presentation and practical workshops involving virtual reality in healthcare. So if you want to know more about this, keep an eye on our website, because there will be more announcements soon. Then stepping over to experimentation. This is kind of a busy slide, but I will try to talk you through. Some of our design research projects, and more specifically user-initiated design projects, we conduct and we try to design methods together with clients, professionals, and informal caregivers to really personalize existing technologies. So we are not designing new technologies at our Experium Health Lab, but we are designing methods together with the stakeholders to really personalize and use existing technologies based on their own capabilities and support needs. We are also always doing this together with healthcare organizations, and importantly also with the product development companies, in order really to bridge the gap between product development and the actual implementation of these technologies. So this is an example of quite large research projects, but we also conduct smaller experiments, like for instance this one. Quite recently, we teamed up with CMLO and Sync VR, and helped clients of CMLO who are anxious about the COVID vaccinations, and provided them with virtual reality classes. And based on their own preferences of the clients, they could watch or swim with dolphins, or watch a movie of a fairy tale forest, for instance, while undergoing the vaccination program. And the clients themselves said, afterwards they were less anxious before, during, and after the vaccination program. So this is really an example of a very small but very effective experiment we are doing together with healthcare practices and companies. Then stepping over to the professionalization program. These are examples of Joyce and Max. This is an example of our virtual communication program. And in this program, you'll be able to really have a conversation, real-time conversation in virtual reality with these virtual humans. This is a collaboration with the simulation crew, and together with the simulation crew, we developed several scenarios. On the left, you see Joyce. This is a scenario in which you'll learn to detect low literacy from subtle hints during the conversation. And on the right, you see Max. This is a scenario in which you will learn to have an intake interview with Max while you're an employee of a health center. So I think this collaboration with the simulation crew is a very nice example of how you can team up with the Experium Health and the simulation crew and really combine both expertises together to really develop high quality new products. Besides the communication training, we also provide tailor-made professionalization programs. For instance, our digital skills scan can be used to map digital skills of employees across any organization, healthcare organization, providing a starting point for an e-health approach to be launched. And the Experium Health will then, together with this organization, develop tailor-made professionalization programs in order to increase the digital skills of the employees of the organization. This is always, as I said, tailor-made program. On our implementation programs, this is a program which will be launched soon. It's still under construction. But this is a similar kind of activity in which our implementations can help our organizations to experiment in an implementation-oriented way. After this administration of this implementation scan, a masterclass e-health implementation can help organizations with really shaping e-health policy and helping management to take the step from experiment to actual implementation of the healthcare technology. I think we'll be able to finish within time. Last but not least, our validation program. According to the validation programs, we have a series of applied research methods we can use, resulting in business cases involving specific healthcare technologies. For instance, in our WeCare program, we developed business cases for Tinybot Tessa. But we can also do this, of course, for other types of technologies and make business cases around specific healthcare products. So this is a very brief presentation about the 5 types of activities we do here. Summarized again: inspiration, experimentation, professionalization, implementation, and validation we can do at our Experium Health Lab. Of course, this is just a very brief summary of the types of activities we do. If you want to know more or maybe collaborate with us, you can always send us an email at experium.health@ham.nl. And besides this presentation, let's see if it's being skipped to the next slide. We have, as Menno already introduced, many interesting presentations at our virtual expo at our stand from Ham University. At 11 o'clock, Mariel and Maria in Dutch will present about virtual reality detecting low literacy, about the Joyce scenario I was talking about earlier. So a very nice presentation about first results, how it is used in education. And then we have every hour up until 2 o'clock today presentation, and tomorrow again starting at 10 and ending tomorrow with a presentation about our design research with 2 PhD students, Niels and Thijs. Niels is from Universiteit Twente. So we are still within time. Thank you very much for your attention. And thank you, Menno, as well, for your nice introduction. I'm not sure we have
Yeah,
some
I have a
time.
question.
Do you have any questions?
No questions.
No questions. Iedereen weet hoe je een vraag kan indienen. Dus misschien zou je dat nog.
Questions. If you're in the platform, you will see a place where you can type your message. I do have a question now. How do you guys at Experium deal with education in this digital area where it's not always possible to use physical technologies like VR robots? How are students interacting with Experium at the moment? It's a question of Pim Meulemans.
Yeah, wonderful question.
Yeah.
This is for you.
Yeah, and it is difficult to answer because it took us a year, I think, to really get used to the situation because it's, as I said at the beginning, really hands-on experiencing these types of technologies. We are now still working on online a website with all kinds of online possibilities to really try to get to the same amount of inspiration from a distance, but it's difficult. And still, I think to get the real experience, especially with the virtual reality glasses as shown here, you really have to put them on your face and really experience it. So the online experience is far less. But still, we are trying our best.
And students still can take the devices with them. So they can come to a university very short period and take VR glasses and things like the Cradle. We have the Tovertafel has been for a month in organization with students. So where possible we give the students our devices so they can use them at their own place or own workplace.
Yeah, just a small example. We just started to make education with physical therapy students, and they all have their own virtual reality classes at home at this moment, and we provide education from a distance in VR. So it is possible, but it's
and so they still can experience themselves how it works, and they can work with VR glasses. So they have to borrow them in little groups. Normally we would have larger groups.
Right. Yeah. Was that also the answer that you're looking for? If not, then please pop in again.
I have another question from Stefano Pepe. If you can tell something more about the devices you have over there, the Cradle. I'm not sure. I think Tessa can't be functioning, but maybe Maurice, you can tell a bit about what they do.
Okay. TinyBot Tessa is a product. It's already a few years old. It's basically online agenda. So you can fill the agenda online on a website, and TinyBot will speak out what's in the agenda. So you can put it in your home of people with autism, elderly people with starting dementia, for instance. And they can get subtle reminders during the day, and Tessa just pronounces whatever is in the agenda. So even for informal caregivers who might be anxious that their parent is having the gas still on when they go to sleep, for instance, you can have very practical hints.
I can also imagine that it's very useful for education. To have reminders for education intake.
This is I forgot the exact name. I think it's the Milo. Milo. I'm not sure.
What's a pillow for the Milo?
Right. It's and this is the pillow. I'm not sure, but it's developed together with HU University, Utrecht, in a design project we did a couple of years ago. And this pillow has inside a human heartbeat. So for people who are anxious or having stress, you can really put it next to you, and the heartbeat can go down a little bit, and then you can synchronize your heartbeat with this Milo. And this is a completely different kind of pillow. This is a game console, so you can play games with this pillow by using it and throwing it around. So you, for people who have difficulties with physical abilities, they can still play games with the film.
And to use this material in this period with COVID, it's not very much possible.
No.
To be due to hygiene. And,
Yeah.
So good.
Yeah.
All right. Well, thanks. Nice question. Yeah, that's okay. Then we round up at this moment. We thank you for attending. Again, sorry and our apologies for the delay of 10 minutes, and we wish you a wonderful day if it's here in the Haan with all the meetings or within the Health Valley event, other meetings. Thanks a lot.
Thank you.